Every decision that a physical therapist or a PTA makes, they need to understand that there's a power imbalance there because that person's vulnerable. They're looking up to that professional for help.
We try to explain to students in educational curriculum to always think about that power differential of the patient-provider relationship and not putting them at risk for blurring that boundary or crossing that boundary.
The delivery of healthcare today isn't done with a doctor the way it was 30, 40 years ago. In fact, today you might see a doctor for 10 minutes total. What you will see is maybe a nurse practitioner or a registered nurse or a physical therapist for that matter, for hours on end.
People go to physical therapy because often they're in pain or they're not able to do the things in life that they want to do. They're already vulnerable. And if they're going to go to see a physical therapist, the physical therapist should know this about their patient and know that they have to be very conscientious about those boundaries.
When we go into that situation, there is inherently a power imbalance or a dynamic that you should be aware of, both the PT and the patient. You are not walking into this scenario with a patient on the same playing field.
Think about what you know about your patient when they come in to get therapy. You've looked through their chart. You know how old they are. You know what medications they take. You know their social history. You know their medical history. You know all these things about them. They don't know any of that about you.
You have this education that you understand how this medical history or this past illness or this past surgery relates to their current issues. Your name tag, the way you dress, what you're wearing, scrubs, professional attire, all these things play into it. And then when you start talking about, we're gonna use this to treat you, or we're gonna use a traction board, whatever it is, they don't understand what they do or how they work. So all these things build up into more and more of an imbalance between you and the patient.
I think it's really easy to just assume people know more than they do.
When patients come in, they don't always know how this relationship is going to play out. And they also have anxiety about whatever appointment is coming up.
That patient might have a history of some kind of victimization in the past.
Patients may be more vulnerable if they've experienced trauma before. They may be more vulnerable if they have feelings of insecurity or if they're not comfortable confronting issues. If they have mental health issues, they're more vulnerable. And so you don't know who's coming in that door.
The responsibility falls on the physical therapist.
Sexual misconduct and sexual boundaries is a little bit murkier water, and sometimes you actually have two victims in the matter. So you have a sexual misconduct situation happen between a licensee and a patient, and it may appear at first glance to be consensual. You don't realize that that power dynamic essentially nullifies that consent. When that happens, it may be that the victim in the matter doesn't even realize they're the victim yet. That's inappropriate. There's a power dynamic there that needs to be accounted for.
The physical therapist really has to understand that they're in a role where that patient is looking towards them for the best healthcare advice or the best treatment. That involves explaining to the patient what that visit is going to entail and explaining the details of everything that's going to transpire during the visit. If there's good communication, it relaxes the patient. They know exactly what's going to happen.
I think it's very easy for therapists to forget that that power dynamic exists and that we are always not at the same level of the patient.